Hi, I'm Dr. Marisha Chilcott with Morpheus Medical Aesthetics, and we're talking today about PDO threads, polydiaxone threads, also known as sugar threads. PDO threads are a type of suture that are used in cardiothoracic surgery. We use them cosmetically in order to give people greater volume and to also slightly move the skin. PDO threads are not painful to insert. Yes, they are inserted. They go underneath the skin using a device called a needle or a cannula, and it feels a little bit like a pinch, not even as bad as Botox. The process of receiving PDO threads involves first identifying what area we want to address. PDO threads can be used to address little lines in this area. My favorite is lines over the lip, lines under the eyes, lines between the eyes, and also be used to give just a little bit of lift to the face or a little bit of lift to the neck, or to pull up and strap up underneath the chin. So first we have to identify what you want to do, and then we need to decide how many treatments it's going to require. Usually treatments require 3 applications, but sometimes more. They're spaced anywhere from 1 to 3 months apart. Downtime is essentially 0. If we are actually putting the threads across the cheekbones or across the jaw where you move a lot, we then want you to not do a lot of chewing or facial exercises or have any sort of facial massage. Most other areas, though, do not require any special activity or lack of activity. Downtime, so to speak, usually means how long before I can go out in public, how long before I can be seen. The greatest risk in terms of this is the possibility of a small amount of bruising. Bruising can usually be covered with makeup, and so I generally tell people that there's no downtime at all. PDO threads act like a scaffolding around which your body makes collagen. So in areas like above the lip, we're making collagen to create a little bit of volume. Similarly, PDO threads put right in here can create a little bit of volume if after receiving neurotoxin like Dysport or Botox, you still have a little bit of a crease, then the PDO thread application can cause your body to make new collagen in that area and smooth it out again. The reason you would use a PDO thread instead of filler is because it's much safer than filler, particularly in this region right here. Same thing for the nose. In the past, we have used fillers right in those areas, but it is now known that those areas can be extremely dangerous with respect to the risk of blindness. And so in our office, we do not fill there anymore. So detailed step-by-step of what will happen when you get your PDO thread treatment is if we are doing something that requires a lot of lifting in the sides or the neck, for example, even in the brows, we will place a little tiny bit of numbing underneath the skin where we're going to enter. Then we put the cannula device, which it looks like a needle if you're not a doctor, underneath your skin, and it goes doot, 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 and then we pull it out and you have a thread sticking out of your face. And then we go doot, 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 and you have a thread sticking out of your face. Then we massage it just a little bit to engage the threads themselves because they have little barbs to hold onto your skin. And then we go and pull it up, and then we go and cut it off. There's no thread sticking out of you when you're done. And then we massage a little bit again, and your face just looks a little bit lifted, or your neck looks a little bit lifted. What's going on there then is that the thread is holding your skin in place with little tiny barbs, and then your body dissolves the threads using an inflammatory response, which results in you making collagen around there. So it really acts like scaffolding. It's like a little tacking it up until your body can hold it together. When we apply it under the nose in this area or across in here, those don't have barbs in them, and so we place them even without numbing. That does not feel terrible, and your body just dissolves it. Did I actually give you a step-by-step? If it didn't feel like that, it's because the steps are so quick and easy that the whole process takes less than 20 to 30 minutes, and most of that 20 to 30 minutes is explaining what the heck we're gonna do. Some results can be perceived immediately, but they're not actually your final result. The final result really requires your body to make the collagen. So because the threads do occupy space, you can see some improvement in lines, and you can definitely see some lift, but the result, if you will, is that more persistent stage, which is after your body's made collagen. That honestly takes several weeks to months, and that's also why we apply it multiple times. We do 3 treatments here at Morpheus typically, although patients sometimes want more. I just had someone have her 3rd treatment, come in for her pictures, be delighted by how much lift she got in her neck, and say, "Can I get 3 more?" The answer is yes. This is Dr. Chilcott. Thank you for listening to me talk about PDO threads, also known as sugar threads. I look forward to seeing you at Morpheus.